So I'm looking for some advice. I recently purchased a practice um, and hired a hygienist a few months ago that has a loyal patient base that has followed her to my practice. One of those patients called today and asked to schedule as a new patient here. And my hygienist says she's a red flag patient that was dismissed from her former office due to a slew of things. My hygienist says she's chronically late, not a great patient. We inform the patient we're not accepting new patients at this time, but then the new patient is like, but you just said that you had new patients. So the question is, how do they proceed? Do we honestly say we're not comfortable accepting her as a patient, or do we just accept her and see how it goes?
This is a very nuanced question as well, right? So things are different than they were when we started out, Ashley. When I started out in 2002, there wasn't social media. There wasn't the ability for people to give 1-star reviews and launch a personal assault on you in your dental practice. So those things need to be taken into account, right? But just like toxicity amongst the team, if you allow toxicity amongst the patient base, you're just gonna make your life miserable. You owe nothing to this patient, right? So if you are prepared for what this patient could potentially do from a public relations standpoint, I would always err on the side of, if you're not comfortable with a patient, fire them before they come into your office, right? So, I mean, that's a gift that they already know from a previous experience that this is not going to be a good patient. So I would just go ahead and just be honest, just be like, yeah, Mrs. Jones, thank you so much for your interest in joining our practice. We know from past experience at the previous practice that you wouldn't be a great fit for the philosophies in our new practice. So here are some alternative dentists in the area that I think you'd fit great with. Soften it up as much as you possibly can with the narrative, but be kind and not defensive if she does attack you online, but have a plan in place anticipating that, I believe. I don't know. Am I right or wrong? I don't know.
No, I like that. Yeah, I think one of the good kind of nuanced answers I liked was, our scheduling availability varies on a case-by-case basis. We do reserve the right to determine if you're a clinical fit before accepting new patients. I really like your idea of, here are some other dentists in the area that we would recommend. Although I'm kind of laughing though, because are you giving her to people you don't like, or giving her to people that you do like?
Well, I mean, if Mrs. Jones is an asshole, then I don't want to send an asshole to any of my colleagues that I actually like, right? So when we're dismissing patients from a practice because of their behavior, or they're perpetually late, or whatever reason, or if they're disrespectful to our team, you always have to give an alternative. Like, we're releasing you, but here's some other practices in the neighborhood. I'm not going to send them to my best friend down the street. Yeah. Of course not. But there's typically a long list of people that you think that they would be more appropriate, and they'd
be a good match.
They'd be a great match. This particular personality would fit great down the street to this particular dude or lady. So.
Oh man, I'm just flashing back to our small town practice days. Just laughing. No, totally get it.
Yeah.
I think we put a bow on that one. Anything else to add?
No, I just, it does come down to, like, you don't have to be miserable in your business. I just finished up a podcast with this gentleman, kind of interviewing me. He was from Australia, actually, has a podcast based out of Australia. And he's like, how do you avoid burnout? It's like, well, surround yourself with people that you like to work with, be a strong leader, make sure that you are encouraging a strong culture. That's your North Star. But once again, it doesn't have to just be with the team that you employ. Like, you get to choose. Like, I remember lots of times I would walk into an operatory and this guy was, they're like, just beware, this guy's been really rude up front. He's throwing the F-bomb around. He's got his arms crossed and he's just pissed off today. So I'll walk into an operatory, and pretend like I didn't hear that. But if he treats me like that, I've said this many times, Ashley, and you've heard me say this. You know what, Mr. Jones? One of the cool things about having my name on the door and the fact that I own this practice is I get to select the patients that I like to work with. It doesn't appear to me that you and I have built up the appropriate amount of trust and rapport to have a strong doctor-patient relationship. So I've elected to give you 3 other options and see you later, Mr. Jones. Like, I don't have time in my life or the bandwidth or the energy to deal with assholes all day. So see ya.